I entered into medical school in 1976. National University of Singapore. Was a government scholar, and graduated in 81. Decided to do some specialty training. At that point of time, we still had many options. However, somehow or another, I was just sort of drawn into oncology, and in those days oncology was under the care of radiation therapy. So we were, well, I wouldn't call it selected, but we requested whether you could just join us for 6 months to see where you were interested. So out of friendship with someone, I decided just to spend 6 months in radiation oncology, and I was hooked because it was one of the disciplines where you could actually make a difference to patients, where you can help people, be relieved of their pain and discomfort, and give people hope, as well as in many situations actually cure people of their cancers without bringing them through too much suffering. So radiotherapy was very, very attractive to me. I started my training in Singapore. Then in 86 I was sent to the United Kingdom in London, where I spent 2 years in the Middlesex Hospital in London itself, where I did my postgraduate degrees. Subsequent to that, I came back to Singapore and worked for the National Cancer Centre till 2001, when I came out to private practice here in Parkway Cancer Centre, working for Gleneagles Hospital Radiation Oncology Centre, where I run this service here. And after 21 years in public service, I came to private practice, and with the experience that we've had in the government service, it makes us in a very good position in private practice to make sure we give good service to our patients in a very broad sense as well as in the deep sense of the word. I think the most important thing for every cancer patient is that do not give up hope. Be reasonable, be sensible, but do not give up hope. And it's always good to have a good, clear communication with their doctors, whoever they go to. And also it's important to, at times when you have any doubts, to get a second opinion, all right, or to clarify whatever doubts they have. Question, I think one of the things that doctors must be ready to do is to always attend to the questions which patients have. Make them have the sense of confidence of knowing that the doctor is for them, that we are here to make sure that they understand the situation, as well as that patients understand their condition and what they need to do to achieve the outcome which they want. So that's very important. And then my recommendation to many of my colleagues who have just come out to private practice, or the younger doctors, is always make sure you have a good working relationship with your patients. Very important.